Today we'll be chatting with Michael Kowalski, who will be teaching a specialty class during our conference this year. Michael, thank you for talking to us with us today. This year, during the Fsoma Acupuncture and Asian Medicine Conference, you will be teaching how to utilize MRI results for acupuncture point selection. Can you tell us what inspired you and led you to create this class?
You know, being in practice for 39 years, I have found the need to understand MRIs that my patients had done and to be able to put them into practice with the diagnosis from the MRI as a tool to correctly treat the patient.
Wonderful. And what is the clinical application of this class that you'll be teaching at the conference?
You know, many clinical applications, upper limb, lower limb, radiculopathies, when nerves are blocked or pinched or anywhere kind of compressed, that's a very good application. We get a lot of patients with nerve problems, and acupuncture is so good for treating those conditions, but especially targeted when you understand the MRI.
That's great. And what are the benefits of taking your class?
I think more success rate with more patients.
And we're all looking for that, right?
Exactly.
And can you share with us your professional history, your background?
Sure. So I got into acupuncture way back in the old days. I started my training in 1981 in England with Professor J.R. Worsley. I learned 5-element acupuncture, and then I was offered a faculty appointment when I graduated in '84. And so I was very lucky to be able to work with him directly and the senior faculty of the college and the faculty clinic and do some teaching. And I left England in '88 to move back to Florida. I'm from Florida originally. I grew up in Miami Beach, and now I live in Jacksonville, Florida, and practice here since 1988. And I've taught a lot of courses for Fsoma, and I've really enjoyed working with Fsoma members.
Yes, your classes at our conference are always wonderful.
Thank you.
What would you say is the success rate of using this technique or this information in the clinic?
Success rate is much higher in my practice since I've been using MRI results and using the diagnostic information of an MRI to target specifically what treatment I'm going to give the patient. So before, I would have a patient, for example, with sciatica. I think we all get a lot of patients with low back pain and sciatica. It's one of the most common things we treat. And I was getting pretty good success rates just by using the acupuncture points along the bladder meridian and so forth. And then when I got the MRI education that I received, which I also did a lot of research on my own, and because there wasn't a whole lot of information out there for us in the early days. And I started to incorporate the MRI data, especially just from the reports. I wasn't trying to be a radiologist and read MRIs on the imaging part, but I took the reports of the patients and I used that information and applied it. So in case of sciatica, I was able to understand which dermatomes, which nerve innervation distribution pathways were being affected. And I was able to treat the nerve root as well as further down along the nerve pathway and have much better results.
Wow, that's so interesting. And could you describe a case where you had the best success using this information that you're going to be talking about at our conference this year?
Oh, wow. So many patients, hundreds of patients I've treated with using MRI results, and really, really great success with all kinds of different neurological problems and osteopathy problems and so on. But probably The most interesting case, I would say, is a patient I have who continues to come to me with PLS, which is a form of ALS. So he has posterior lateral sclerosis. And I was consulting with another colleague who specializes in treating ALS and PLS. And he talked to me about the Wato Jiaji points for L3-4, L4-5, and L5S1. And when I started using those points on this patient, I saw a remarkable change in him. And he was going downhill pretty fast. And he had been for some time. But within 8 to 12 months of getting acupuncture on this protocol, plus I was doing, of course, other treatments on him, but using those points every single time I treated him, he stopped getting worse. And the NIH studies him. He's in a study with the National Institutes of Health up in Bethesda, Maryland, and they verified that his deterioration of his condition plateaued. And so he hasn't had any further deterioration. He's still walking around. He uses a walker, but he's able to walk around where most people with PLS are in wheelchairs in well under 2 years. And I've been treating him for over 8 years now, and he's been stable for over 8 years.
Wow, that is an amazing story. Thank you for sharing that. There is obviously a lot of power in learning how to read MRI results. We are so excited to have you this year again, teaching at the Acupuncture and Asian Medicine Conference. Your class on Utilize MRI Results and Acupuncture Point Selection is a biomedical class. It's a 3 CU class, and you're going to be teaching Friday, August 25th at 9 a.m. live in person in Fort Lauderdale Beach. So I hope everyone can join us. As you can see, this is a class that is going to strengthen your clinical ability and your results with your patients. So this is definitely not something that you want to miss. And we hope to see you all there, and we will see you there, Michael. Thank you so much.
Thank you so much. I look forward to it. Hope to see you all there.